Hello, my name is Dale Schamberger. I'm a Global Health Fellow working at the Trofenio Clinic, also known as the Center for Human Development, and I'm going to give you a virtual tour of the clinic. Here behind me we have our reception and the waiting area where patients check in. We see approximately 20 patients per day, and that's a mixture of adults, pediatric patients, as well as obstetric patients coming in for their pregnancy checkups. Just off to the side here we have our pharmacy, where there's a wide variety of medications available, and patients are able to purchase medications right after the visit. This is the nursing and physician station at the clinic. This is where we spend most of our day. When a patient arrives, they're checked in by the nurse. The vital signs are filled out on a paper chart and it's brought to the physician or student who's going to be seeing the patient. At that point, the person who's going to take care of the patient goes to see the patient. You note your observations in the paper chart. If you wish to prescribe medications, you write a paper prescription and the patient can go to the pharmacy to have that medication filled. And then if you would like to obtain laboratories, you fill out the lab form here. The patients pay for the labs, and then they have their blood or other samples taken by the nurses. The patients then would typically wait in the waiting area for their lab results to come back. And then once you have the lab results back, you see the patient again, you discuss the results, and fill any other medications necessary for their care. Now we are in the nurses station, where patients come to be checked in by one of our wonderful nurses, Macaria. Here they take the vital signs, they do weight and height right over here. And then once the patients are checked in, they present them to the residents, students, physicians that are working in the clinic. Thank you for your help, Macaria. We have 2 adult rooms and 2 child rooms. We're just going to head that way now. Here we have our 2 adult rooms, Clínica 1, Clínica 2. The first room here has a fairly good procedural capacity, which includes we have oxygen, we have a procedure cart for sutures, other sort of basic procedures. We also have the ability to place IV fluids and resuscitate patients to a limited extent. If they require extensive resuscitation or experiencing sepsis, then we may need to refer them to the nearby hospital, which is about 45 minutes away. Before we talk about the birth center here at the Center for Human Development, I'd like to introduce you to the clinic director, Dr. Tony Bolaños. He is here Monday through Friday. He is an excellent resource for pediatricians, infectious disease. Really, any question you have, you can come to Dr. Tony and he will help you out. Now I'd like to explain to you a little about the birth center here at the Center for Human Development. This is a nurse midwife run program that's available 24 hours a day to our patients. Approximately 40% of women give birth at home in this community. Therefore, the purpose is to provide a safer, more controlled environment with physician backup if necessary. The role of the trainee, either the pediatrician, OBGYN resident, internal medicine resident, is to provide backup for the nurse midwife in the event that there is a problem with mom or baby. Here we have the birthing room. As you see, there's a bed for mom. Mom can stay up to 24 hours in this facility as part of the birth center, and there's also an infant warmer as well. Here we have our 2 pediatric rooms. We see approximately half the patients every day are pediatric patients. They present for a wide variety of illnesses. Malnutrition and infectious diseases are fairly common, as well as diarrheal diseases. And we also do some well baby checks. We have a community program that goes out into the community to check on newborn babies as well as pregnant mothers, and we also receive a fair number of referrals from that program as well. Here we have our clinical lab building, which is just a few steps away from the clinic itself. we have both a clinical laboratory to support the clinic as well as a research laboratory. Now we're going to take you inside for a little tour. Right this way.
Hey!
Welcome to our clinical laboratory. Here we have some of our laboratory staff. In this lab we have the ability to do automated CBCs, several microscopic tests, as well as rapid testing, for example HIV, dengue testing, Zika testing, and hemoglobin A1C. So here we'd like to highlight that we have an ambulance that's available to take patients who have emergencies to the nearby hospital. This is available 24/7. One of our clinic staff here drives the ambulance. And then right behind me we have what we call a tuk-tuk, which is sort of like a motorized taxi, essentially motorized vehicle that's similar to a motorcycle. And we use these to reach out to our community to be able to get to places, houses that are very far in the community and difficult to reach. The community programs go check on newborn babies as well as pregnant mothers, and then we also use the tuk-tuks for research studies, for example the Zika study that's ongoing right now. Now we'd like to show you the house where trainees, residents, and students live. It's known as the Buffs House. As you can see, it has the Colorado symbol there. And now we're going to head inside to give you a little tour of where you'll be living while you're here at the clinic. Here we have the inside of the clinic. There's a little courtyard. Excuse me, here we have the inside of the casita, as we call it, but it's actually a fairly large house that can house something around 20 people. There are several rooms around the outside, and then behind me we have the kitchen and living room area, dining area that I'll come show you now. This is the dining area, living room, and kitchen for the house. And here we have 3 meals a day prepared by our wonderful chef. And then there's also some couches and a TV in the other room where you can relax in the evenings. As you can see right now, we have the house decorated for Christmas, which is a very exciting time around here.
Yeah.
This is our kitchen, and this is our wonderful chef Melly, who prepares our lunches and dinners and breakfasts. And she does a great job and keeps us well fed.